Let's learn about the different stages and phases of labor during pregnancy. Labor is a series of continuous, progressive contractions of the uterus which helps the cervix to dilate, open, and to efface, to become thin. From the time you admitted in the hospital, doctor will periodically gives the internal exam to determine how far the labor is progressed. Each labor is different, however it is typically divided into 3 stages: labor, which includes latent, active and transitional phases. Delivery of the baby. This phase begins with cervix completely opened and ends with the birth of the baby. Delivery of placenta. In this phase, placenta will be pushed out from vagina after the baby comes out, or doctor has to pull it out.
3 phases of the labor stage. Latent phase. It is the first phase. Contractions might last around 30 to 45 seconds and gradually increase the intensity and frequency from around 20 to 5 minutes apart. In this phase, discomfort might be minimal. The cervix dilates approximately 3 or 4 centimeters. Some women might not recognize that they are going through labor if the contractions are mild and irregular. Active phase. It is the second stage. Contractions might last around 40 to 60 seconds and the frequency is around 3 to 5 minutes apart. In this phase, cervix dilates approximately anywhere from 4 to 6 centimeters to 7 to 8 centimeters. Pelvic examinations are periodically performed to measure the dilation of the cervix. Transition phase, which happens when the uterus has reached full dilation and contractions are coming around 1 minute to 2 minutes apart. This type of labor lasts about an hour on average, but the length varies from person to person. There is a feeling that the baby is almost out, and there may be some bloody vaginal discharge or bright red blood with each contraction.
During pregnancy, there are 2 types of labor: Braxton Hicks contractions and active labor. Braxton Hicks contractions are contractions that happen during pregnancy as a result of increased levels of the hormone progesterone. These contractions cause the uterus to tighten up and can last from 10 minutes to 2 hours. These types of contractions don't produce any significant pain or other symptoms. They can be uncomfortable, but they will not progress a woman into labor. Active labor is the time when a woman's cervix will dilate and she'll have regular contractions causing her pain, reduced mobility, and frequent urination due to pressure on the bladder from the baby pushing down on it from inside her uterus. It is important for a woman to recognize what type she is having. In some cases, labor does not start automatically. It has to be induced, which is a process of stimulating or inducing the labor to begin. Every woman's labor experience will vary depending on her age, how dilated she is, what type of labor she has, whether or not it's her first time giving birth, etc. But these 3 phases provide a general guideline for what's to come during pregnancy.
For more information and updates, visit our website babyneed.in. Thanks for watching this video completely. Please like, share, subscribe to our channel for more videos.